Hi, my name is Lenny Weiland, and I reside in Millburn, New Jersey. I have been married for 34 years, and I have 3 adult children. I am a blues harmonica player with lung cancer. I was diagnosed in November of 2019 with stage 4 non-small cell lung cancer. Being a non-smoker, it was really a shock. Um, but I'm happy and proud to say, as of today, you're looking at someone who is Ned. And for the audience that doesn't know what that means, I have no evidence of disease. My first symptoms were, prior to diagnosed in November of 2019, I started to walk funny. My gait was a little bit off, and I had a slight pain in my right leg. Me and my wife, oh, you're 62, it's probably arthritis. We just kind of ignored it. And then later on in November, I started coughing and wheezing. I was using my inhalers a little bit too much for my mild asthma. So this time around, after 34 years, I listened to my wife. And I took her advice and went to see the doctor, who was on vacation getting married. So I ended up going to an urgent care in New Jersey. And top to bottom, they did a great job of checking me out. Blood tests, urine tests, checked my breathing, oxygen level. I even had a chest x-ray. And they diagnosed me with, you have a slight touch of pneumonia. I was okay with that. I've had pneumonia in the past, and they gave me a 5-day regimen of antibiotics, and I went along my merry way until the phone rings Saturday morning at 8:30 in the morning. Why is urgent care calling me? Mr. Weiland, we see an opacity on your left lung. So I said, wait a second. Maybe that's the bronchitis, right? Well, may or may not be. Go for further testing. Speak to your primary physician. So I did that, spoke to my primary physician a few days later, and she recommended me having a series of tests, hooked me up with an oncologist, and we had a lung biopsy done. My lung collapsed after the lung biopsy. I didn't know the lung can reinflate itself. The human body is amazing. I was in the ER and stayed overnight and was released the next day after my lung collapsed. And then the biopsy showed I had 2 walnut-sized tumors in my left lung. And they were in a bad position, they said. It was at the bottom lobe. Not that any tumor in your lung is good, but this was inoperable, meaning because it was in a bad position, they couldn't operate on it. I also was diagnosed through a series of PET scans and CT scans with a walnut-size growth on my femur in my right leg, hence the walking funny and the gait being off. And then finally, a MRI showed a lesion on my cerebellum in my brain. So that was a whole lot to digest. Being a non-smoker, saying, how can this be? How could I end up with all these things? So the first thing they did to treat me, they said, we want you to go for surgery immediately. So on December 31st, while you were out partying and enjoying the new year, I was in the hospital having a 4-hour surgery to remove the tumor in my right leg. And they put a 15-inch metal rod in my femur so it wouldn't break. And the next thing they did for me was on January 20th, my wedding anniversary, they said, we want you to have radiation. So I had cyberknife to my brain. That's a targeted therapy that zapped out that bad boy. So I said to the radiation oncologist, what's the success rate on this? And he said 95%. I said, go for it. 95, I'll take it. And that was successful in zapping out the lesion in my cerebellum. The tumor in my femur was removed. And then I started a regimen of immunotherapy and chemotherapy. So every 3 weeks I went for infusions. The regimen I was on was the immunotherapy drug called Keytruda, as well as the chemo drug called Alimta and carboplatin. So that cocktail, as they call it, was the standard protocol for someone with my condition with the PDL1 expression. So what is PDL1 for your audience? So PDL1 is a protein that attaches to a healthy T cell. So here's a T cell, a normal T cell that we all have to fight diseases, not just cancer. And what this protein does, it's a bad protein. It attaches to a healthy T cell and it cloaks the cancer. So your body, your immune system can't find it. So what does chemotherapy do? Or I should say immunotherapy. The immunotherapy learns how to target that protein and penetrate it. It teaches your body how to fight the cancer. They also tested for biomarkers, and the word biomarkers are really important for your audience to understand. Depending on what your biomarker is will depend on how they treat your cancer. So the biomarker that I had, like I mentioned, was a PDL1 expression. There are many, many different biomarkers that you could have. Like I mentioned, ALK and CRAS. I had none of those. I just had the PDL1. But the biomarker testing is really important to have. And it's amazing that some people don't have it. It's something that for me, I don't understand. You have to know what type of cancer you have. What is the makeup of this cancer? How are they going to treat it? All dependent on your biomarkers. So yes, I was treated with Keytruda because I had the PD-L1 expression. So I was on those 3 drugs for 2 years. And then after the 2 years, I was put on just the Keytruda. So I was on the Keytruda for 3.5 years. And then my body said enough. So we do know that cancer treatment, be it chemo or immunotherapy, not only hopefully destroys the bad cells, it destroys good cells. And with that being said, you have side effects. So the first thing that developed was I ended up with hypothyroidism. Your thyroid is working slow, your metabolism is slow, you're putting on weight. And 1 pill a day controls it perfectly. So in retrospect, that was the least of my issues, having that issue. The hypothyroidism was the least of the issues. As time went on, they stopped the chemotherapy because of that issue. And then I continued with the Keytruda immunotherapy, where it was stopped because, again, I was having side effects. I ended up with microscopic colitis. We know that's inflammation in your colon. Along with that came the terrible side effects, different digestive issues, bowel issues, throwing up, nausea. I lost 20 pounds. It was a great diet. I don't recommend it to anybody, but I lost 20 pounds. And then I ended up getting elevated liver and kidney enzymes were elevated where they were critical. So I ended up in the ER twice because of that. And that's when my oncologist said, you're done. Your body had enough. We don't want this, to continue this. So I stopped all drugs. And I was fortunate that after about 2.5 years of being on the drugs, the doctor says your last 3-month scan showed no measurable tumors. I was like, no measurable tumors? What does that mean? You don't have tumors that we can measure. There's no borders. We can't tell you what size it is because it's not there. She didn't want to say, Lenny, you're Ned. No evidence of disease. She didn't say you're in remission. And I was like frustrated with that. I was like, I'm looking up in the dictionary, remission, Ned. I'm looking at the dictionary. I'm dating myself. I looked it up online. What's a dictionary? I looked it up online, Dr. Google. And I said, wow, I really do meet the criteria for Ned in remission. After a while, she gave in and said, okay, after like 5 scans every 3 months, okay, you're Ned, you're in remission. The way I was able to deal with what I was going through, the first thing I have to say is my faith. I'm so fortunate that my faith kept me grounded. Just believing that I can get through this and that there's a being somewhere, my God is watching over me. So that really helped a lot. And another really important thing was joining a support group. So when I was first diagnosed, I joined Cancer Hope Network, and I was partnered with a gentleman, and rest in peace, Pat Torres, would be on the phone to me and call me up and stay in touch with me. They match you with someone that matches your demographics, your age, your disease. And he'd call me every so often, and you're flooded with all these questions of what's going on? Am I going to be okay? What's this feeling I'm getting? What's that? What drugs am I taking? What's it going to do to me? And he was there for me. And when he passed away, I said, I'm going to pass it forward. I'm going to keep that torch burning. And I joined Cancer Hope Network as a mentor. What do cancer patients need? HOPE. We all need hope. We all need something to cling on to, something positive that we can believe in. And Pat gave me that, and I share it with other people now, being in remission and just enjoying life. And I wake up and, how do you feel today, Lenny? I feel pretty good. I'm going to play my guitar and harmonica and learn a new song. Or I'm going to go out and do yard work and cut the grass and plant something. Or I'm going to speak to someone in my support group and help them today. There's no sense of dwelling on negative thoughts. We know positive thinking goes a long way, helps your body heal. I've been involved with Merck. Merck is a company who actually developed Keytruda. The drug is not that old, like penicillin's like 55 years old or whatever. Keytruda is only several years old. So there's not a lot of data on it. I'm constantly trying to learn about the drug I'm on and everything related to it, but there's not a lot of data about it because it's so new. But to me, it's a game changer. People ask me, should I go on it? Listen, I'm no doctor. Speak to your doctor about it. But for me, it gave me the ability to be here today with you, I believe. That the Keytruda is a game changer. Talk to your doctor, learn about your disease, ask questions, use Dr. Google a little bit, use your professionals, the medical team more. And you can do it. It's not a death sentence anymore. The statistics have changed.